Numbing has been applied to my model for 30 minutes prior. She is now clean and prepped. Start by putting the needle into the device. You line up the 0 and the notch. Push it in, click, and you turn it a little. Now it's locked into your machine. Then you take a protective sleeve and you slide and pull through until it lines up just above the device. Now I am ready to start a procedure. I am turning my machine to a level 3 speed, and then you adjust your depth on the handpiece. Today I'm going to use hyaluronic acid on her face and start on her cheek. While you're working on their face, you want to work in sections so that the hyaluronic acid or vitamin C does not all absorb before you finish the section you are working on. I'm going to set it to a 1 millimeter setting for her cheek. Pull her skin tight and then work in an upward treatment position. My model doesn't have any wrinkles, so normally if your client had wrinkles, you'd need to pull the skin tighter. Do vertical pass, and I do a horizontal pass. Always working from the inside out. I stop right on her cheekbone because people often get rosacea there. I do one last pass at a diagonal. And that is her cheek section. Now I'm going to do her other side of her cheek. Again at a 1 millimeter. As you can see, it glides very easily over the skin. Our tips are made with SureLock and SureSpace, a patented protection for our patients. The SureLock makes them be one-time use so that we never have to worry about a patient having any cross-contamination. And the SureLock and the SureSpace is making sure that they penetrate well so that the patient gets an even treatment. Now I'm going to move on to her chin, and I'm going to change the setting to 0.75. As she has her wrinkle and deep chin line there, I'm going to stamp over that with the third pass. Now now move on to her upper lip. She's getting a little pinpoint bleeding. Each procedure, the depths need to be dependent on your patient that's in front of you and what their skin type and texture can take. As your client, as a skincare professional, you need to make a decision on where. We have guidelines to follow on depths, but we do recommend that you, obviously like any procedure, take into consideration what your patient's skin looks like. Now on her forehead, I'm going to move it down to 0.5 and work in sections again. Because with microneedling you don't have to worry about any hair lice. If anything, it will cause hair to grow. You can go right up onto the brow line. Now I'm going to apply more hyaluronic and go down her nose and do her lower lids. On noses, I turn the device to 0.25, and you want to avoid this little bridge right here that's bony where you can nick people, so you be really careful in that section. I'm going to adjust to 0.25. You want to go down her nose bridge and away from their eyes on all of your treatments. It helps with pore size, so you want to get those edges of noses where people have a lot of build-up pores. Now I will go over her bridge there. I recommend doing this at a 0.5 or 0.25. And then when you get up to lower lids, you want to pull tight, and you can go all the way up right to her lower lid. And then pull on her upper brow. And if they don't have permanent makeup, you can do one right around there to get a little bit of a brow lift. Now I'm going to apply another layer of hyaluronic and a squirt of vitamin C just to help with any pigmentation she has before I apply our hydrating mask. Take off the clear side, clear plastic. You apply to their face. This will help to soothe, cool, push in the topicals deeper, and also take out the redness. The masks are great post-procedure for any treatment, and they are also great for sunburns. I'm going to treat her neck. Flip this up. Squirt some hyaluronic on her neck. Our hyaluronic acid is a 1% hyaluronic, which is a very strong, and it is great for the skin to penetrate. I'm going to set my device to 0.75 for her neck and pull her. Avoid that little mole she has on her neck. As you can see with our device, you get a very even treatment. Her skin is all smoothly red. There's no lines or striping. Going over this area that people have a little double chin, help get extra tightening. By treating their necks, you get a great tightening. It's great after facelifts. If people have a facelift scar, you can get there and it helps really tighten up their necks. It's also just great for anti-aging and tightening. more hyaluronic. Now I'm going to put on a neck mask to help cool and push again the topical deeper into her skin. That completes our microneedling session and treatment. Now I'm going to show how to treat a scar with the scar serum. I'm going to turn up the device to 1.5 for the first pass to see how she responds. Go straight through it. She was just fine. I'm going to turn it up to a 2 millimeter. Cross hatch across it. Still could do a little deeper. I'm going to turn it up to the 2.5. I'm going to go across it again. I'm going to go across hatch again. Now I'm going to stamp through it. Now she is masked for 15 minutes, and I am going to dispose of her mask and then apply the Phyto to her skin. I like to rub it on, and then I like to press it in. Now I'm going to apply the Phyto serum. Post-procedure, it is very important not to wear sunscreen or any other creams other than our serums that we know are safe. Okay. Post-procedure, you'll remove the sleeve. You will turn the device to 0.0 and the notch, and you'll pinch and pull it out. Then you will dispose in your sharps container. The on and off switch, the power switch, the device switch, and the foot pedal plug. The device cord has a safety, what would I call that? The device cord has a safety plug that you plug in with the red dot with the red dot. It will not pull out. You must unlatch it by pulling out the device by moving the latch. Again, you line up the red, and the red clicks in, and to release you must pull the clasp. Also, that is the same on the device. It goes in. To pull it out, you must push the button and pull it out by pushing the black button. The foot pedal plugs in and pulls out. Power cord. Unplug. Turn it on here, turn it up to recommended speed setting 3, take off the protective cap, adjust to the depth you would like to treat with. You can either run it by pushing this, or you can run it by the foot pedal. Take the tip out, you line up with the notch on the 0 and the notch, you pinch, and it's one-time use.